My name is Patty Wise. I'm a PA and I work at Hillsdale Medical Associates, which is part of Hillsdale Hospital. I do family practice, and one of the most important things I do with my patients is organize their cancer screenings. So we do not have a screening for every type of cancer, but there are 5 main cancer screenings we do. The recommendations vary depending on which organization you're talking about. For breast cancer, I typically recommend starting screening at age 40 with a mammogram, and we offer a mammogram every year. Some organizations might recommend every 2 years, but that's between you and your primary care provider as to which makes the most sense for you. One thing to understand about screenings is generally the recommendations are based on a patient with average risk. So it's very important to know your family history and discuss that with your provider, because that might change whether you're at average or high risk, and that certainly changes screening recommendations. The next type of screenings is colorectal screening. This has changed. This screening for colon cancer now starts at age 45. That used to be one of the wonderful things that comes along with turning 50, but now when you turn 45, it makes sense to start colorectal screening. There are a couple of types of ways to screen for colon cancer. The gold standard still is considered to be the colonoscopy. The colonoscopy is both diagnostic and treatment. So for example, if a polyp is found during a colonoscopy, it's usually clipped off, and that polyp may in 15 or 20 years have gone on to develop cancer. It's gone now. So in that sense, it is considered the gold standard. Many people don't seem to want to do a colonoscopy, or at least want to learn about other options, and there are other options. Probably the second most important option for colon cancer screening is the Cologuard, which is an at-home stool test. And we place the order for the patient, and it gets sent to their home, and they sort of follow the directions, and that can be done every 3 years. The next type of cancer screening is lung cancer screening. It is for current smokers at the age of 50. So from 50 to 80, we can do a low-dose CT scan of the chest to look for signs of lung cancer. The goal of all screenings, if there is cancer, is to get it at its very earliest stage so that treatment may be more successful. So again, for lung cancer screening starts at age 50 for current smokers, or someone who has a 20-year PAC history and and even if they have quit, it's less than 15 years ago. So again, it's 20-year PAC history. PAC history means if you smoke a pack a day for 20 years, 1 times 20 is 20, that's a 20-year PAC history. If you smoke a half a pack a day for 40 years, half a pack times 40 is a 20-year PAC history. So those people are eligible for lung cancer screening. What that means is not everyone is eligible for lung cancer screening. Have to be 50, 20-year PAC history, either currently smoking or quit less than 15 years ago. And those are typically done annually until the age of 80. The next type of cancer screening is for cervical cancer. So this is a cancer for females, of course. We start doing Pap screening. Papa Nicolau is the name of the test. Starts at age 21 through 29 every 3 years. From 30 to 65, if you do co-testing with high-risk HPV, that's human papillomavirus, which is the virus that causes cervical cancer, that can be done every 5 years. So again, between age 21 and 29 for young women, it's every 3 years, just the Pap test. Between ages 30 to 65 can be done every 5 years as long as there's high-risk HPV testing, co-testing it's called. I would also like to mention that there is now a vaccine that protects against cervical cancer. That's the HPV vaccine. I believe the brand name is Gardasil, and that is offered to young people starting around age 11. It's a 2-shot series. And the reason I mention that is that I believe is the only vaccination we have against a type of cancer, and I want people to know that. The next type of cancer screening is prostate cancer for males. The current recommendation is offering and discussing with patients a blood test starting at age 55 to 69. The blood test is the PSA test. That stands for prostate specific antigen. It is not recommended to do that screening test at age 70 and above, because prostate cancer is believed to be a slow-growing cancer, and the ages to screen are 55 to 69. Now, of course, we discussed high risk versus average risk. All the screenings I've discussed so far are for average risk. Let's say someone, for example, has a first-degree relative who had colon cancer at the age of 40. that changes your risk factor. And so each of these screenings needs to be discussed with your primary care provider and come to the best decision that's very specific to you, your personal health history, and your family health history.